Good afternoon, everyone. My name is Desmond Banks. I'm a clinical assistant professor here at the Boise State University School of Public and Population Health. I'm also the chair of our Continuing Education Committee. I'd like to thank my co-committee members here today for making today's presentation possible. Today, we're in for a tremendous treat. All of our sessions are terrific, but today is going to be extra terrific. We are blessed by the presence of Ms. Heather Hansen, who's a tobacco and vaping education specialist at the Eastern Idaho Public Health District, and is also somewhat of a celebrity here within the state and nationally, as was featured within a recent documentary titled Nick's Sick. So today we're going to focus on the dangers of vaping and essentially what public health and parents need to know. So with that, I'll close my mouth and turn my camera off and turn it over to the special guest of today. Thank you.
Thank you so much, Professor Banks, for that wonderful introduction. I am going to start here by sharing my screen. Let's see. For some reason, we tried this just a minute ago, but for some reason, I'm not seeing my presentation now. Let me find it here again. Okay, here we go. Okay, you guys are seeing the full screen, is that correct? Okay, perfect. So I wanted to start today just by telling you some of the programs that I offer and coordinate here in our health district. Most of these are available statewide as well. And these are the ones that I just really love to do and share with people. I do Dimensions, which is a behavior change course through the University of Colorado. It is for adults, but it is a way to help them stop using tobacco products. I do Catch My Breath, which is a vape prevention program for youth grades 5 through 12. I'm also a national trainer with Catch, so we're able to get that into lots of schools. We have a parent and caregiver workshop as well, which is just based on giving people information, giving parents, educators, just community members information on vaping and the harms that it can cause, especially to our youth. I will be sharing a lot of information from them today because it's just really great information. And then I offer several programs through the American Lung Association. Freedom from Smoking is for adults. In Depth and Not on Tobacco are both for youth. Those are specifically created for youth. They are both available online as well as in person. So that gives our youth a really great opportunity to find a way for them to be able to quit using tobacco products. So No Vape, you may have heard about the campaign with Idaho Public Television. They started a campaign a couple years ago called No Vape, Be Smart, Don't Start. We were able to get a survey through them. They had a Boise group called Rathbone Falvey do a survey on the outcomes of that campaign, and we were able to get some really valuable information just because unfortunately we're not able to do a lot of surveys in schools just due to some current regulations. We found out that 1 in 5 Idaho 13 to 19-year-olds do vape regularly. This is twice the rate of a national average. So this is a pretty concerning rate and something that we really want people to be aware of. We know that a third of Idaho teens feel positively about vaping. The younger teens are even view it more favorably than those who are older. So the sooner they start, the more addicted we're going to get. So we're really concerned about those younger kids having those positive feelings about vaping. And 86% of teens do know and acknowledge that it's harmful, but they also state that knowing that isn't enough to prevent them from vaping. So we really want to get some information out to them so they can not even start using the product, because that's where we really get into concern, is when they're using these products at such a young age and getting an addiction. So here's another number from that survey. 38% of Idaho teens have tried vaping before, and 21% of those teens are currently vaping. So that tells us that once they try it, they like it and they continue, or they also are able to, that addiction has started, so they're not able to stop. One quick note here I should have mentioned, please feel free to put any questions in the chat. We'll answer those at the end, but if you're thinking of something, just so you don't forget, go ahead and put it down there. We'll get to as many as we can. And then if I'm not able to answer all those questions, I'm happy to answer those by email and share those answers with you later as well. This is another pretty concerning study that was done. Idaho ranked number 4 on states with the most vapors. This is not a number where we want to be at. We were the only Western state that was in the top 10. We also found that adults currently use e-cigarettes at a 5.4% rate. This tied with North Dakota. And we know that youth vaping leads to adult vaping. So that's why we kind of are looking at adults as well. Idaho also was 3rd in the percent of adults who vape some days. This was 5.2%, which compared to the national average of only 4%. So we were quite a bit higher in that. And then Idaho was also number 8 for the state with the most residents that vape every day. So again, that shows us a high addiction level that we're kind of dealing with. So let's kind of talk about the youth e-cigarette epidemic, what they are, how it happened, how it started. So e-cigarettes are kind of like, you can think of them as a phone, like an Android, an iPhone, or maybe even a Mac or a PC. They do the same thing, but they look a little different. But at the end of the day, it's a device that heats and disperses liquid, so that liquid can be inhaled into the lungs. So all e-cigarettes have a battery, a microprocessor, an atomizer, and a cartridge or a tank. There's a lot of different variations on this, but the process is basically the same. The microprocessor senses a change in pressure when the user inhales on the end of that e-cigarette, and it basically instructs the atomizer to activate the heater, and this aerosolizes the liquid, and then the user can inhale that through their mouthpiece. So e-cigarettes actually create a chemical change in the e-liquid that is heated to produce this aerosol. When you think of the aerosol, you can think of like a room deodorizer spray or regular body deodorant spray or like hairspray. Think of all those little particles that are in that vapor, and that's what is happening with an e-cigarette. Here's kind of a look at the evolution of e-cigarettes and how they've changed over time. So there's a lot of different variations. We have disposables, rechargeable, tanks, refillables. And if you look at that first generation there, it looked like a traditional cigarette. It was meant to be used and then thrown away. We then had our second generation, which looked more like a pen. It was smaller and refillable, so you didn't throw it away, you could just reuse it. Third generation, this was larger. It had a rechargeable battery, a really large refillable tank, and this was started being called a mod. You could modify the parts on it. This is when kind of the contest came into play, and people would see how big of a smoke cloud they could blow with these vapes. Fourth generation, they became sleek, high tech. They had rechargeable batteries, and this is kind of when Juul started. Juul kind of created the population and atmosphere for our youth to use because they were so sleek and looked pretty cool, like a fun techie device. Then we have the fifth generation, which is when disposables came into play. They were reintroduced into the market in 2019, and by 2023, 60% of youth who used e-cigarettes used these disposable devices. The most common product is the Elf Bar, which happens to be illegal to be sold in the United States, but somehow our youth are getting a hold of these. And it doesn't really matter the style, the generation, they all have pretty similar health and social consequences. So e-cigarettes don't have that harsh burn that you find when you use a traditional cigarette. It's not going to feel that way on your throat. So this makes it really easy for our youth to not only start using, but to continue using because they don't feel that on their throat when they use these products. This is done through nicotine salts. They have a lower pH than free-base nicotine, and it allows for really, really high levels of nicotine to be inhaled, and you don't have that irritation on the throat. So because e-cigarette doesn't have that harsh burn, we have a higher use. And according to the 2024 National Youth Tobacco Survey, there were 1.63 million youth who were currently using e-cigarettes. There were 2.13 in 23. So you might think that's better because it's gone down a little bit. That shows 7.8% of high school students and 3.5% of middle school students who currently use e-cigarettes. The current use was reported at just over 38%, and the frequent or daily use was reported at just over 26%. So both of these numbers have gone up. So although overall use has declined slightly, the daily or frequent use has gone up, again, showing us that high addiction. And the current use, again, was reported as disposables and refillable pods. So flavors are used also to mask that harshness of the tobacco. This is really kind of a seductive and deceptive technique that tobacco companies have always used. Think about menthol cigarettes or fruit flavors. There are thousands of different flavors available. According to the 2024 National Youth Tobacco Survey, just over 86% of users reported that they used a flavored cigarette. That came in with candy being first, fruit was first, then candy, then mint. The FDA has taken some steps to kind of mitigate this appeal. They implemented some restrictions like labeling requirements, but they are not really consistently applied. An example that might be a little more relatable would be like if we go to the store, buy a package of Oreos, we can look at that ingredient list and we can see every single thing that is in that package of Oreos. The same is not true for e-cigarettes. So this kind of shows us where our students and youth are being exposed to ads. This was according to the National Youth Tobacco Survey from 2022. And this is where our kids are seeing it. So we want them to know that these are ads that are specifically focused on them and that they are trying to be sold a product. If you think about your social media use, like you can't really control who follows you. You can control who you follow, but you can't control all of the content that you see. So we might be looking at something pops up. So this is what is happening to our kids too. That certain age group is targeted and they are seeing these kind of pop-up ads. Because I research this stuff and look at it all the time, I get e-cigarette ads from companies like crazy. I actually got a coupon for a free product for my birthday. So this just shows you how we don't have control of the ads that we're seeing. Juul kind of was the one that brought this social media into the spotlight. They utilized hashtags, peer-to-peer promotion. They had Juul challenges. They had a lot of social media influences, and they encouraged people to use their Juul devices. So it's important, again, that our kids know that they are being sold a product. And kids do not like that. They do not want to be sold something. So this kind of shows what Juul's marketing campaign did. In just over a year, they jumped from about 24% of the overall e-cigarette market to 75%. So that shows that advertising and marketing does work. And our kids do see social media. Just over 91% of middle and high school students report that they use social media. And among all those social media users, just over 75% reported that they have seen an e-cigarette related post or content. So it does really play an important role. And we want to make sure that with, TikTok and YouTube, that our kids are understanding that this is a product that is being sold to them. And so if they like somebody or follow somebody, they might not necessarily be a user, but if they are a user, they might also be getting paid to do that. So it's important that we make sure that our kids are aware of that. So let's take a look at some of the laws of e-cigarettes. We're all kind of born with a potential for addiction. It could be alcohol, nicotine, social media, exercise, caffeine, chocolate, video games, like really anything, right? So why are we so concerned about nicotine? When our teens use it as adolescents, it harms the part of their brains that control attention, learning, mood, and impulse control. Those are things our students and our kids need. They do not need that to be altered when they're learning and when their brain is changing and growing every day. So if we think of it in kind of some biology terms, every time we have a new memory or we learn a new skill, a stronger connection or synapsis is built in those cells in our brain. And when our young people are doing these things, because they are young and learning, these connections are built really fast. And nicotine actually makes a physical change on the way these synapses are formed. And because of that, they're more likely to be addicted to other drugs in the future. So that's another important thing for our youth to know is this can lead to harsher drugs, stronger drugs, and really a longer addiction. Their brains are continuing to develop until they're about 25. And so if we are able to prevent them from using a product like this until they're 25, it's highly likely that they are not going to use this or any other drug if they have just waited until they're a little bit older. In January of 2017 and September of 2022, the average volume increased from 1.1 milliliters to 5.7 milliliters in nicotine strength. So that's a pretty big jump in how much nicotine was going into these products. The size also increased, and there were 48 new products that were introduced with a 6% nicotine strength. So a pack of cigarettes has about 20 cigarettes in it, and each cigarette is about 10 to 12 puffs. So that's about 1.8 milligrams of nicotine per cigarette. Last night I looked up some of the newest products. There's between 3 and 10,000 puffs in some of these new vapes. So that is a ton of nicotine. We're talking about 20 to 25 grams in a pack of cigarettes, and this has 3 to 10,000 puffs. You can get a 10,000 puff vape for $13.95. That's a pretty cheap, affordable price. So when we have a teen who is addicted, they're going to have withdrawals because their body is not used to going without that. And so they can be depressed, they can be anxious, they can have a hard time sleeping. It can be really hard for them to concentrate. So because of these withdrawal symptoms that they'll have, they can turn to nicotine to get rid of those problems. And it's not really helping the problems, it's feeding the addiction. And this creates a cycle for our youth. So it's really important that our youth have some ways to deal with stress, because these products are marketed and advertised as a way to relax or not have stress or just be free of all your troubles. So here are some of the items that we find in that vapor of e-cigarettes. Of course, nicotine, it's in over 90% when tested. It's, I believe, 99% the last time they were tested. This includes e-cigarettes that say they were nicotine-free. Ultrafine particles that are getting lodged into the lungs, they can't come out. Heavy metals, nickel, lead, and tin. And diacetyl, if you've heard of that, popcorn lung. So this is an irreversible, and you have heard it if you've seen the documentary, this is an irreversible disease. So when our kids are using these products, it's linked to flavors. That flavoring has nowhere to go. And so that's what causes this permanent damage in their lungs. There has been a vape-related lung injury linked to vaping in every state. Idaho's was in 2019. It was a young man who had vaped for about a year. So that's some pretty fast, serious damage. So this aerosol does have these liquid particles, these gaseous chemicals, and the user inhales it and exhales it. We know there's potentially cancer-causing chemicals. The two main ingredients in a vape do make formaldehyde when you mix them together. And so this really, we know it's affecting their respiratory system at the very least. One thing that we like to use with our adult learners is to say, you could potentially say it's less harmful, but if you think of less harmful and harmless, if we jump out of a third-story building, versus a 10-story building, we're still going to have harm. So that's another important thing that our youth know, is that harm is associated with these products. It is a nicotine product. So we often want to ask ourselves, why do teens start? What can we do, if anything, to prevent them from starting this? The most common reason for initiating tobacco use or vape use is because their friends use them. This was from high school students. From middle school students, it was because they were curious about them. And if we take a look at current use among both middle and high school students, it's because of their feelings of anxiety and depression. Unfortunately, these products exacerbate both of those things. So that's when they get stuck in this cycle of trying to release that anxiety and depression. And they use the product, they get more addicted to the product, their anxiety and their depression increase. So it's important, again, that we are able to give our youth some healthy alternatives to deal with stress and anxiety. There was a study that was published in 2021 that found that e-cigarette users and non-smokers had about 3 times the odds of initiating a traditional combustible cigarette compared with non-cigarette users. So 3 in 10 students who currently used any tobacco product reported using 2 or more tobacco products during the past 30 days. This is true for youth and adults that I work with. Adults who try to use vaping as a cessation tool, which it's not an approved cessation tool, end up as a dual user. So they use both. And they actually end up using more nicotine because you can vape anywhere, even if you're not supposed to. Like, it's pretty sneaky. You can do it anywhere. It doesn't have that smell that traditional tobacco products have. And a lot of clients that I talk with actually do it in bed at night because it's so easy. So again, they are creating a super, super high addiction. So this chart shows rates at which our youth are beginning to vape. This is really unfortunate because we were in such a good place in tobacco control. This generation was going to end the use of youth tobacco. That's where we were on track for. And now we are right back up there to the highest rate of youth using tobacco, as we were at its highest points at about 24–25%. You can think of maybe a link between vaping and smoking. Definitely shows the tobacco industry's motives behind it. In 2018, there was a $12.8 billion investment by Altria, who is the parent company of Philip Morris. So it's pretty clear that they're looking for replacement smokers because they found a product that appears to be safer. In January of 2020, the presidential administration banned all flavored pre-filled pods, except for menthol and tobacco flavors. The FDA finalized this enforcement, and it was also set to punish retailers who were caught selling these unauthorized flavors. This was a really significant step in moving forward, but the ban only included pre-filled pods. That's why our youth have moved to disposables, because those are not included. There were also a couple exempted products that included the Soar and Drop and the Smoke Board Kit. This shows kind of the jump that we saw amid this flavor ban. Disposable e-cigarette use increased about 1,000% among high school users and 400% among middle school users. So this trend of disposable e-cigarette use does still continue, and disposables are the most popular on the market. To get around the FDA laws on e-cigarette bans, Puff, who was temporarily taken off the market, you may have remembered that in 2020. This was because of FDA enforcement, but they came back in full swing in 2021 with a synthetic nicotine product in 2022. The president did sign into law giving the FDA authority to regulate those products that were made with synthetic nicotine as tobacco products. So again, we were able to close a pretty big loophole with that federal law. But these e-cigarette companies are always able to find a loophole and come back stronger than ever. So they were able to continue selling e-cigarettes, and they were all the time attracting and addicting kids. Puff put in an application for their synthetic nicotine product. They were denied by the FDA. but they now advertise their products contain zero nicotine, and they are on the market. The FDA does have authority over all e-cigarettes, and this doesn't matter if they're regular nicotine or synthetic nicotine. This is another really important point to share with youth. So as of July 2025, there are only 4 e-cigarette companies that are authorized to be sold in the US. This is Enjoy, Views, Juul, and Logic. But authorized does not mean safe. Authorized means they did their paperwork. And this is a statement from the FDA. While these products are authorized to be sold in the US, it does not mean these products are safe, nor are they FDA approved. And again, most of our e-cigarettes sold in the United States are illegal to be sold in the United States. Here's another example of our FDA enforcing some laws. In August of 2023, they did issue warning letters to 15 online retailers for selling and distributing e-cigarettes that look like the items that you see on the screen here. They're appealing characters. They look like school supplies, toys, and drinks. And there's a new one, you'll see that game that actually does play a video game, so these can be pretty hard to spot. This is an example of another e-cigarette. They come in a lot of different shapes and sizes, containing nicotine, synthetic nicotine, natural extracts, and other drugs, even CBD, THC, or marijuana. This particular one is called Ripple Plus. It is similar to Puff in that it claims that their products are plant-powered and have zero nicotine. I encourage you to go to their website. This looks like the most holistic, relaxing product available. But they have a statement on their website that is similar to Puff's. It says humans of Ripple Plus must be of legal age, and their statements have not been evaluated by the Food and Drug Administration. So if they are truly nicotine free, why would you have to be of legal age to buy them? Okay, nicotine pouches are super, super popular. They are just the new up and coming product. They're called snus or Zyn. They're sometimes called a lip pillow or an upper decky because you stick them in your lip. They have a lot of different flavors. Their advertisements show kind of freedom to use the pouches anywhere. They're really hard to detect because you don't have to spit. You just are able to swallow. In 2024, 1.8% of middle and high school students reported that they use nicotine pouches. This included 2.4% of high school students and 1% of middle school students. Those who reported current use, 29.3% reported frequent use and 22% reported daily use. So again, showing a high addiction level there. Among those who reported use, 68% reported Zyn. That was followed by On, Rogue, Velo, and Juicehead. And you can see how cheap these are. They're super, super cheap. You can get some for under $5. There are some different resources that we have specifically for youth in order to help them quit. You'll see the American Lung Association, the FDA, and Truth Initiative up here. Over 65% of students who currently use tobacco products have reported that they are seriously trying to quit, and over 60% have stopped using for at least one day in the last 12 months because they were trying to quit. On December 20th of 2019, the president signed legislation to raise the minimum age from 18 to 21. This was again a big win for tobacco control because there should not be anybody still in school that is old enough to purchase cigarettes or nicotine products and share those with younger students. So this is another good thing. Pharmaceutical waste. This is kind of an overlooked thing. So by law, vapes are not able to be thrown in household trash. I was at a coalition meeting just about a month ago, and a local organization who houses kids who have nowhere else to go brought up the fact that kids go behind vape shops and get vapes out of their dumpsters. So if we were able to take some action on what these vape shops are doing with their waste, this could make a pretty big dent in kids not only having access, but it would probably be a pretty expensive thing for them to be taking care of all that waste by law. So this probably, I'm hoping, is something that becomes a little more stringent in the upcoming months. And if you have a passion, I would encourage you to check this out. This link here will actually take you to a site where you can report an environmental concern. And vapes in any trash is absolutely an environmental concern because nicotine is poisonous. The amount of poison control calls that have been documented in the last few years has just gone out of control because of the use of vapes. This is kids getting into vapes, pets getting into vapes, and even adults accidentally spilling that liquid. If you do come in contact with it and touch it, you don't want to touch anything because you don't want it going through any cavities on your face. You want to immediately wash your hands. That's another important lesson for kids. Keep it away from children, keep it away from pets. And if you see it, get an adult, don't touch it. Another area that Idaho, unfortunately, is lacking in is our tobacco control. So this is from the American Lung Association. They have basically a report card on how we're doing. So this tells you that overall we are not doing as well as we should be doing. I'll go into a little bit of this. So tobacco prevention and cessation funding. This is basically the amount of money that we are spending on tobacco control. And our grade could not be worse on this than it currently is. So you can see how much that they are recommending that we spend and how much we're actually spending. Some of the things I do with the funds I have Millennium funds. If you are not familiar with those are funds that were awarded because of the tobacco settlements back in the 80s. So we do have a fair amount of funding, but again, not what is recommended. I do geofencing, so anybody that enters a school property in my health district gets a vape ad. Most of the ads I do come from Idaho Public Television. They have some really great content. I also do ads in movie theaters. I did a bunch at summer movies. I teach in all the juvenile facilities. Our youth want help quitting these products. They just need somebody to help them to be able to quit. I have a quit kit that I give to really any youth. They're specifically for my health district, but any youth in Idaho that shows interest in a quit kit, they can get that from me. And it's just a bag that is full of stuff to help them to successfully quit using tobacco products. They need some distractions. They need other things to do. And then I just recently did some videos with the Idaho Department of Juvenile Corrections. So any youth who is in a facility, their parents get these videos about our resources, how we can help. And then as they are released, the youth and parents get these little PSAs, again, so they can just see resources and that there is help available for them. They just need to reach out to us. So we have a C on smoke-free air, which isn't terrible. This is just, it explains kind of below here why we have the grade that we have. E-cigarettes, unfortunately, are not included on things as much as they should be. I was walking into Home Depot a few months ago getting some stuff from work, and the lady in front of me blew her vape right into my face. So again, that's secondhand smoke coming right into my face. It's in our parks around here a lot, which is super concerning. I recently got through Project Filter, which is Idaho cessation line, 97 signs for them to put up in parks around our area. Unfortunately, at the last minute, they changed vaping is not allowed to vaping is discouraged. So there's still a little bit of stigma as to us being firm on we should have clean air, right? Like it's our right to have clean air. If they want to use a product like that, they're welcome to, but they don't need to subject others to the harms of that product. There are some new studies about second and third hand vape. So third hand is going to be your surfaces, right? Hard surfaces, soft surfaces, and they're seeing that that is as harmful as second and third hand traditional tobacco smoke. And tobacco taxes. This is one that I think we could really easily change if we had people who were willing to change it. We have pretty much the lowest tax rate in the nation, and it hasn't been raised in ages. This is shown to be the most effective way to get people to stop using tobacco products. So this, in my opinion, is something that we're kind of missing the boat on. And then access to cessation services, we have a B. So that's a pretty good grade there. I do have all medications, over-the-counter medications here at my office that I can share with people. Usually when adults come to see me, they are needing a organ transplant. So they have kind of hit the bottom, right? There's nowhere for them to go. They have no choice but to quit smoking. We could do a little better here, but overall, we're not doing too bad here with cessation services. And then flavored tobacco products, this is another one that we just haven't kind of caught up on where we should be. We don't really have any specific laws in regards to flavors. So Catch My Breath, as I mentioned earlier, is the program that I teach and train in. So this is there's a parent toolkit, and this is a question and answer session that adults can go through to see if their child is at risk trying e-cigarettes. And one of the things we teach in the course is it's not if your child is exposed to e-cigarettes, it's when your child is exposed to e-cigarettes, because they will be exposed. And we want to make sure that they have tools to help them to handle that situation so they're not put into a situation that they're surprised and uncomfortable with and don't know what to do. So this toolkit is really great at teaching parents what they can do to help. This is one of my favorite quotes from Catch. So children who have to check in with their parents about their free time are half as likely to try tobacco products. Those are amazing statistics. And all they need to do, they need to know where their kids are, who they are with, and when they're going to be home. That's really something that parents should be asking anyway. And I think it's really important for parents to understand that their children do care about what they think. And this is something that's really easy for parents to be able to do. So this is a little activity that I really like doing here. I'm going to show you some vapes. Let me see if I can get the chat box up on the screen. And I want you to tell me which ones you think, these are office supplies. Some of them are vapes. And I want you to say which ones you think might be a vape. Could we put, just in the chat, put your guesses there. There are actually 6 of them that are vapes. I'll give you just a second to do that. And this can be kind of a hard activity because they're changing all the time. So something that's a vape today or something that's not a vape today might be a vape tomorrow. Okay, so we have here B, C, F, G, I, and J. So this is just kind of to show you how easy it can be to hide these devices from a parent or grown-up. Along with this, there are a lot of different devices that companies are making to hide these. You'll see the watch in the upper left-hand corner. A lot of people wear sports trackers. This does that, but it's also a vape. It charges it and lets you know when the e-liquid code is low, so they can always have that basically on their person. You'll see the hoodie. This has tubes throughout it, so they can hide their vape in a pocket inside, and then they basically have it all right there. And if they're chewing on that straw or that string, are they really chewing on a string? Are they using their vape? We have one that looks like an asthma inhaler in the upper right-hand corner. This one is particularly concerning because it looks exactly like an asthma inhaler would look. You'll see a little crochet Etsy bag on the bottom left, this is available for any kids to purchase on Etsy. It does not come with a vape, but it is kind of a distraction, and you wouldn't suspect that there was a vape in that if you saw a kid wearing that as a necklace. And then we have the little container down there, the water bottle where you can stash items in, and a small vape does fit in that water bottle. It looks like a brand name water bottle. And then you'll see the phone. We know most of our kids have phones, and this has a little spot there to hold their vape, and it charges it, and again lets them know when their liquid is low so they won't run out. These are a couple items that were confiscated at a school last year. So this particular kid had attached his vape to his straw in his water bottle. We encourage our kids to, be healthy, stay hydrated, drink water throughout the day. And this kid had his vape with him all the while doing that. And then you'll see the Sharpie. This is a jewel. So the marker was actually carved out, and it fits a jewel perfectly inside there. Again, if you saw a student or child carrying this, you would have no idea that it was actually a vape in there. And then we also really want parents to know how to talk to their kids about e-cigarettes. It can be kind of hard and intimidating, and sometimes it's a conversation you don't want to have, but if you have that conversation, it is going to really let your child know that you do have some thoughts on this, and also that they care about you and they don't want you using these harmful products. So just let them know, what your expectations are, be clear about it, how to respond. You don't want to be alarmed. A really good thing to do is just ask them. So I hear that there's vapes at school. Is that something that you're seeing? And see what they say. And if you remain calm and just take in the information, they are likely to talk to you about it. You can tell them why you think it's important, and then make sure that you have consequences. Let them know what is going to happen in your home if you find those products in your home. This is from that parent toolkit that is available on catch.org as well. So Catch My Breath is the first evidence-based youth vape prevention program. And this is one of my favorite numbers about this program. So the average 7th grade class has 192 students. If we don't do anything, 17 of those students are likely to try e-cigarettes. If they go through the Catch My Breath program, 8 of those are going to be prevented from even initiating use. So if we were to implement this in every middle school in the country, over 153,000 kids would not try e-cigarettes in a single year. These are amazing numbers and tell us how helpful this program is. And then if you're kind of an advocate and you want to know what you can do, there's another page in that toolkit that tells you exactly the things you can do. There is a presentation on Catch My Breath that you can share, and I'm happy to do a community presentation on Catch anytime. It's about an hour long. It's super interactive. It's really fun. So if there's a parent group or community group that you think would be interested in that, I'm happy to help facilitate that. And contact the school district that you live in and just see what they do. See if they have a program in place. Catch My Breath is offered in every single district in Idaho. So if this is not being taught in a school where you have a family member, friend, somebody that you love and care about, they have access to the program. They just need to contact their health district. There's a couple links there to report unsafe things, and also go to your elected officials. Let them know that we need more regulation on these products, and these are products that we don't want in our community. So this is what the parent community resource page looks like on Catch. You'll see that second one there is where you can get the parent toolkit. You can download that, and I can also paste a copy of that in the chat. And then there's just a lot of different information. There's PSA videos on here. Again, a good thing to watch with your kids. It opens up the lines for communication. And with that, here is a QR code that goes to my page on our website, and there's my contact information there. And then if you have any questions, thank you so much for spending your lunch hour with me, but I am happy to answer. I'll leave that on there for one more second. I'm happy to answer any questions that you might have.
Heather, thank you. Thank you for sharing your expertise and your passions and your perspectives and just a wealth of incredibly helpful information during your lunch hour. So thank goes all to you. At this time, guys, please feel free to put any questions within the chat. Also, feel free to just unmute yourself and go ahead and put them out there that way. I see that there were ones that were submitted in the chat previously. Ms. Hansen, this refers to, I believe, the chart on the funding. And the question is, does the federal funding increase if the state were to increase the monies allocated for tobacco control?
So our state is actually, our funding, sorry, is state funding. Millennium Funds comes through the state, and it's money that we've had for just over 20 years. We actually are only using the principal of that money. We are not the interest, sorry, the interest. We are not touching the principal of that money. And we do get allocated a fairly good size amount, but again, not what is recommended. The thought process definitely is if we were to use all that money that they would give us more because there is more to give. Part of that funding was the partnership with Idaho Public Television. So that was an increase in funding that just happened a couple of years ago due to that relationship. And we work really closely with Idaho Public Television, and they are continuing to award those monies. But if they saw a need and saw things being spent well, I believe that they would probably increase the funding.
Thank you. Thank you, Heather. Any additional questions?
I do see a question here about metal deposits in the bloodstream. So the heavy metals from the vape go into your lungs and they cause, little tiny cuts in your lungs, those heavy metals, and those heavy metals don't come out. There's not a cleaning system in your lungs. And also that because the heat is so hot on those coils in the vapor, the metal off of those coils also is sucked right into the lung. I see a question about blood sugar. I'm not aware of the impact on blood sugar. That's a fantastic question. The flavors specifically, because they don't go through your liver and, liver pulls out the toxins because the liver it gets stuck in your lungs. So they're not going through your liver. So the liver cannot pull out the toxins. And that's one of the reasons why the flavors are so harmful.
So, hi, this is Stephanie Borders. I'm the marketing manager at Central District Health, and I'm kind of new. Wondering why when we show messaging, it's always happy kids and not like in Europe, if you go to the airport, even in a European city, all the packages have, lungs and people who have lost their voice boxes and all that. What is the psychology behind showing like happy kids?
So studies have shown that kids want to be relatable and they want to see happy things. So if they see the carefree youth, then they associate that with not using tobacco products. That's kind of what the research has shown.
Thank you, Heather. Any additional questions?
Hi, Jane Clappin here. So I have a quick question. I know, I think it's one of the Scandinavian countries, maybe Denmark. I recently read they're introducing legislation to put an age cap on social media use. I think it's 14 years would be the legal age, or 15 years. Have you seen any evidence that an age cap on social media use, since that is the ubiquitous form of communication among our youth these days, that could have a positive impact on preventing tobacco use?
I haven't seen any studies on that, possibly because there aren't any kids who don't have social media. but we do know that social media definitely encourages use. So you could likely say that without that social media, that the kids would not be introduced to it or see it in such a positive manner. And I did just paste the parent toolkit in the chat if any of you want to access that.
Thanks, Heather. And just in tandem with that, so I know I've been studying public health science for a long time. So I know that a strategy of alcohol companies and tobacco companies has always been to target youth. Like, I don't know how many of us are old enough to remember like the Camel ads and the other cigarette ads where people are out having fun on the beach or playing volleyball, the cartoons, etc. And the reason they did so is because that strategy works for brand loyalty. Do we find the same thing along with vaping, that kids who start with a specific brand, they stick with that brand?
The kids that I talk to, at least, they seem to jump around quite a bit depending on, because there are so many changes with vapes, like because something will get banned, so they'll jump over to another product. I do work with adults who have told me that they remember Camel dollars from their parents and they got to go pick the prize. So those things definitely worked. And I also recently was in a class with some youth and I asked them, because we were talking about specific commercials or ads for vape products. And I'm like, so think about the last party you were at and tell me what it was like. And they pretty quickly said that that's really not how people who are vaping look. They really are not having that good of a time.
Thank you.
Heather, I have a question. Is it okay that I put the link to the PBS documentary and which you
Oh,
shared Start
absolutely.
with within the chat here?
Yeah.
All right.
If anybody hasn't seen that or go to their website, so there's the whole documentary and then there's little snippets. There's little 3 to 7 minute segments. And those are great to just watch with a youth or somebody that you're concerned about, even an adult. I go to the jail, the Bonneville County Jail, and do classes every week. And adults are simply not aware of the harms of vapes. So it's really a message that we need to share that there's harm involved with these products.
Um, Any additional questions?
Hi, it's Jane again. Sorry to jump in. I just so popcorn lung, we've known about that for at least a decade now, right? How can we integrate that into because I know in Idaho law, like you said, there's a lot of difficulty in obtaining information from underage kids via surveys, et cetera, because of legislation that was passed that their parents have to know. So how do we implement a proper PSA on what exactly popcorn lung is? And essentially, I'm just like prevention through discuss, like
Yeah.
reversible tobacco, for example. We know you can heal your lungs. And once you stop, like immediately leads to better health outcomes. But with vaping, I'm really disturbed by the fact that you said within a year there was irreparable damage. So what can we do to press more to put that out there, like physical images, imaging? Is there any sort of specific strategy?
I'm going to see if I can grab really quickly a image that I share. So if you've seen the documentary Nick Sick, there's a scientist in it, and he talks about the harms of flavors. And this is in one of the little shorts. So this is a short that you could share. You could share it on Facebook, social media. Let me see if I can. And there's a slide that he shows that looks like this. And I show this in all my classes. So when he talks about this, I think that might have been upside down. So when he talks about flavors, this is the difference in a cell with e-liquids and without e-liquids. And this is basically what flavors are doing. So if you can see, I don't know how well it's showing across there, but there's a pretty big difference in cell activity. And there's a lot being done on bone health specifically. The documentary talks about that. They've been studying bone health specifically and vapes for probably about 12 years now. And there's definitely some link to poor bone health and vape use.
Wow. That's fascinating. Thank you very much, Heather. It looks like I see another question within the chat. Do we know what the particulate matter size is released from vapes, or is the majority heavy metals and volatile compounds, organic compounds?
You know, we don't, just because they haven't been around as long, we don't know the full answer to that, but we do know that there are definitely volatile organic compounds. We know that there are cancer-causing compounds, and we know even if we take out the high amounts of nicotine, which are so concerning, we know that the flavors are harmful. So there's really nothing in a vape that is not harmful. Those two main ingredients make formaldehyde. So you can't have a vape without formaldehyde. Propylene glycol and glycerin. When you mix them together, you get formaldehyde. And again, when we see these high temperatures, when we mix two things together and we heat it, we then have a third chemical. So the long story, we probably won't know for a few more years, but the short story is pretty concerning.
Heather, thank you. And if you could please, I know this may not be your area of expertise, but explain what formaldehyde is. That was one of the things that I literally jumped out of my seat when I saw the documentary. I was like, wait a minute, let me rewind that. Formaldehyde is?
So formaldehyde is a known carcinogen, meaning it's known to cause cancer, and it's basically embalming fluid. It's used to preserve dead bodies. So we're basically inhaling that right into our lungs if we're using a tobacco product.
That doesn't sound appetizing. No, I'm literally when you said that during dark, I said, wait a minute, I remember that from, the little, I
And
think
our
that's
kids don't know
embalming.
that. Most
Right.
kids ask me what formaldehyde is, so they don't know.
Yeah. Oh, wow.
Really just education,
Yikes.
like just share what you know.
Right. Right. All right. All right, guys. We are coming up on the end of our time. I want to thank everyone who attended and thank our special guest today, Ms. Heather Hansen. We have been provided with a wealth of information, and this will be shared on our website and catalog throughout all eternity. And I cannot thank you again, Heather. And if it's possible, before we end, can I put your email in the chat so that
Yeah, please
individuals who
do. I'm
have
happy to answer any
questions
questions. Yeah, or
that we
anybody who
have?
wants a community presentation, I'm happy to do that as well.
Absolutely. I'm going to put it within the chat right here and give folks some time to take this down. Right. All right. And we can also share it through email for all who have attended. So thank you guys. I hope that you learned a great deal. I'm sure that I did. And we'll see you again next month. All right. Take care,
Hope
everyone.
everyone has a wonderful afternoon. Thanks, Professor.
Absolutely. Thank you.